opposed to tanning beds, but we just need to keep all of these things in mind, okay? All right, YouTubers. Hopefully by stopping and starting, we'll get some of you back. I don't know. Any other questions over here on Instagram while we're waiting for YouTubes to join in? I'm going through and making sure I didn't miss any. Ohio, can you hear me? You're over there on YouTube. Are you able to hear me? Is the connection okay there on YouTube? You're the only one there. There's only one of them. We might have to turn it off and just focus on the Instagram. Well, Ohio says that he can or she can hear. Okay, Jeffrey, thank you. All right, so Jeffrey's here. Sounds like everything is going okay. Do you guys have questions? So that was a good idea. We ended the YouTube and restarted, and now we're getting some connections. Okay, now 1910 says everything is better. So good idea, 1910. Thank you for the recommendation to stop that and restart it. And it looks like you guys are able to hear me. So shoot me the questions, okay? Let's go. All right. How many of you guys use collagen? Do you use collagen? Are you a believer in collagen? What about creatine? These are some supplements that I go back and forth on. And creatine being a necessary element in our body, molecule, it is made from amino acids. And many of you will say, hey, let's, oh, Shane, I went through a whole spiel before I cut off on NAC. You're telling me that you didn't hear me? Shane, I went through the whole spiel. Do you Instagrammers want to hear my spiel about the NAC again? Shane, I did go through the whole thing on NAC. I didn't know that you couldn't hear me. So let me know if you heard the my lecture. Okay. Briefly, Shane, NAC, I don't think we should take it. If you think that you're needing cysteine, more cysteine, to help with the production of glutathione, I would ask you, why is your cysteine low? If your cysteine is low, is your homocysteine converted to cysteine? If your homocysteine level is elevated, why is your homocysteine elevated? Okay? Is it lack of B vitamins, like B6, B12, folate? Those are ways that homocysteine can be elevated. Or the enzyme needed to break down homocysteine to cysteine is not available. Does that mean you simply just go take N-acetylcysteine? I don't think so. I don't think that that is in your best interest to simply take N-acetylcysteine. I think it's disrupting a normal biologic process that's going on. I would lean more toward the fact that our liver is not working very well, okay? That your liver, it has some problems going on. Glutathione needs glycine, glutamate, and cysteine. And if it's not getting that in the nutrition, even though glycine and cysteine are non-essential, they become used up if you have a lot of oxidative stress going on. This may sound complicated, and it just takes more and more review, you guys. But I'm getting to the point for Shane that, should we just take N-acetylcysteine? No, I don't believe we should, but it's going to be controversial, all right? It's going to be controversial, and I think everybody's going to have their own opinion. My thing is, let's look for the root cause. Why is cysteine, if it is low, why is it low? Okay? It could be a lack of dietary nutrition, and it could be simply that your liver is malfunctioning, meaning your liver is taking on things that it should be doing other functions. It is the master organ. It does make glutathione, but it could be being used in other places where, like fatty liver. Fatty liver will decrease the liver's ability to function. All of these things need to be taken into consideration instead of just jumping into taking a supplement. Okay. All right. 1910 says, I have a patient who recommends, and she looks great in her 60s. So I bought Vital Protein Collagen on sale at Costco, but it's been sitting in my cabinet, don't like it in coffee. I think if we are consuming nose to tail on our animals and eating things like chuck roast and grain, just ground chuck, we're going to get enough collagen. If you feel that you need to take a collagen supplement, you want to take a collagen supplement, you don't simply want to stick with bone broth, maybe get a brand like Iron Feather. Maybe try that and get the original. You don't want to get a flavored. You want to get the no flavored. So I personally don't take collagen. It's not that I'm opposed. I'm just saying, what if it's not even in there? I just don't trust collagen supplements. And I've not heard very good reviews on Vital, whatever that brand is. So I can't speak to them. I can't speak to that. I would just rather eat, the skin and the tendons and ground, chuck roast and ground chuck. I'd rather just do that. Naked collagen is a good source. Okay, I've also heard of Naked creatine. So it must be the Naked brand, Dirty Muffler. And I believe if I'm going to use a creatine source, I'm probably going to use Naked creatine. Okay? Collagen is the proteins that are in our skin and our connective tissue. So let's just take for our skin, for example. The proteins in our skin is collagen and elastin, okay? And collagen and elastin, if they're disrupted, cause wrinkles. How does collagen and elastin get disrupted? Oxidative stress and glycation. What's glycation? Since collagen and elastin are proteins in our skin, glycation is whenever a sugar binds to a protein. So if sugar, glucose, fructose, bind to protein, collagen and elastin, glycation is this binding, and glucose and fructose gum up that protein and make it not work so well. So then you are more at risk of developing wrinkles. Aging of your skin will be more with a lack of collagen and elastin that has been glycated or some sort of oxidation has occurred to those proteins, okay? Is hyaluronic acid the same as collagen? It is not. Hyaluronic acid helps with hydration. And again, it's going to matter on the size of the hyaluronic acid. Usually people use hyaluronic acid in stuff as well as topically. So putting hyaluronic acid on your skin, for instance, is it able to penetrate through those layers to get to the deeper layers of hydration? Some dermatologists and specialists say, no way. Others say, well, if you get this special nanoparticle, it can get through there and cause, and cause the uptake and cause hydration. And then there's hyaluronic acid fillers and gels where we go in and make our cheeks bigger by doing fillers, and some use hyaluronic acid. It's something to look into, but again, these are a lot of supplements that, hey, since we had to end on YouTube and end that first session, can you go ahead and hit the like button again and hit the subscribe button if you've not already done so? I'd really appreciate it. Okay. I don't know what you're talking about there, Stan, so we'll just put you on a little, let's see. I know, MJ, I appreciate you defending me, but they're in a little bit of a timeout here, okay? I really don't want to, I will not tolerate any negative comments in regards to, you know, things. I don't need those kind of comments. Dirty Muffler says, Naked is the brand. Yes, they have egg white protein powder as well in case whey is difficult to process for anyone. Egg white protein powder. It's a powder. It's been processed. I would suggest just eating the egg whites if you want to, although if there is any part of the egg that we're going to react to, it's going to be the whites. The yolks less so. There are enzymes and chemicals inside the whites of eggs that make that we react to. How do I say that? That we're going to be intolerant of. What is for breakfast? I do not eat breakfast. So what are you having for breakfast? Hopefully eggs, bacon, maybe some steak. And MJ, I don't, what was your question? I cannot find it. Oh, what are the liver enzymes to check? ALT, AST, and GGT are good enzymes to check. If they are low, that as well as high, so the optimal levels of AST and ALT and AST is around 10 to 15. If they're elevated, that is a sign of liver dysfunction. And if they're low, you can also note that the liver is not functioning well either. So some sort of stress is going on. It needs to be looked into. But great question. Thank you for asking that. Okay. Are you a dermatologist? No, I am family practice. I have dandruff. That is seborrhea. And that is usually, it is usually a fungal infection. And something you're doing is feeding the fungus. A great treatment, I don't know if you're a guy or a girl, but a great treatment is Sulson Blue, selenium sulfide. It's not zinc sulfide, selenium sulfide. And if you are a male, I would make sure that if you have a beard, do your beard. In fact, do your face, because seborrhea that's in our hair drips down onto our face and can cause inflammation. But I would start with something like as simple as diet. Are you feeding your, most people say it's a cleanliness thing. And yes and no. But everything that occurs on our skin happens from the inside out. So something is going on with your guts, something is going on with bacteria, viruses, fungi in your body. Viruses, bacteria, fungi feed on sugar, and they love to feed on iron. So I would have things looked into if you have those problems. People who are insulin resistant can have problems with seborrhea. And seborrhea, like I said, can drip down onto our eyebrows and onto our skin and can cause situations of inflammation and redness on our skin and dry and flaky conditions. But for a quick fix, selenium sulfide is awesome. Head and Shoulders does not work as well. Selenium sulfide. Richard, I do not know the answer to that question, but thank you for asking. It's an interesting concept. I have seen those on YouTube. They put that black paint all over their roof, and I'm trying to think. It's not just so much for insulation. It's also to block EMF, I believe. But please do not quote me on that. That was just maybe something that clicked into my head just now, and because you said painting your tent. All right. Let's see. I'm looking for questions. If you have a question, you guys put a question mark in front of it. Are you into intermittent fasting? I am. I do intermittent fasting every so often. I don't try. I eat when I'm hungry and I fast the remainder of the time. Some days I am hungry 2 times a day, and sometimes I'm hungry 1 time a day. Like yesterday, I ate once. I ate a lot at once, one meal. I ate almost a pound of ground beef and I think it was 4 eggs. So yeah, a lot of times one meal might suffice depending on how hungry I am. And then other times I will definitely get hungry later in the day. I try to eat my last meal before 5 o'clock or right at 5 o'clock. My first meal might be around noon. Shane asks, what is your opinion on retinol, salicylic acid, niacinamide? Are they worth trying? Could bad acne be more related to liver or guy issues? Both, Shane. One, Shane, since you know, if you know me well, finding the root cause. Why is acne bad? Okay. Is something else going on? Look at your hormone levels, but why are your hormone levels bad? Is it something you're eating? Usually it is. Remember, our gut causes skin reactions. It's one of the first signs that we know that before we have, well, I didn't know I had gas and bloating and cramping and all that stuff because I was just so used to it. But I really noticed my skin because everybody can see it. They can't really know that I have belching and bloating and gas and cramping unless that. Okay. But Shane, what is my opinion on retinol? Again, these are controversial things, okay? If you have acne, is salicylic acid good for acne? Yes, salicylic acid is an exfoliating acid that is good for acne. So is blue light masks. But then you're going to be looking at more blue light. And then you'll say, but they told us not to use blue light. I agree. So we got to weigh all of the things that are going on. First, I would find out, why do I have acne? All right. Would I use retinol for acne? One, I would try to get rid of the root cause. And then, is retinol bad for our skin? Retinol being vitamin A, retinol being tretinoin. There are stages of retinoids, and tretinoin being prescription version. There's low-level retinoids, like esters. They're very weak, and they don't cause as much problem on our skin, okay? Our body can handle them a little bit better. They're a weaker retinoid, okay? Then you can go a step up, and you could have a retinaldehyde, okay? A retinaldehyde is the closest thing to a retinol tretinoin. So they convert into the main tretinoin, the main retinol, if this is making sense. Some people do not tolerate tretinoin. Some people don't even tolerate a retinaldehyde, a retinol. You have to look when you're buying these things online. Is it a retinoic acid? Is it an ester? Is it an aldehyde? Is it even stronger than that? In each one of those, there'll be esters that are 0.025, 0.05, 0.1, and then you'll move up to the next one. So go slow. I think consistency is better than strength. So if you can handle an ester, get the ester, get the lowest dose ester, and start applying it every night before you go to bed, okay? Then if you're tolerating that and maybe your skin is starting to replenish itself, maybe you bump up a little bit. Like I said, retinaldehydes can be bought over the counter, and then the closest thing to one step away from converting to the actual retinol. Niacinamide, AB vitamin. I go back and forth on niacinamide. Do we know if topical B vitamins or topical anything can get through our skin, but if it goes through our skin, know that it's going to affect us systemically. So I go back and forth on niacinamide. Do I use niacinamide products? I do. I do. Do I use retinoid products? I do. Salicylic acid is a great exfoliator, even if you don't have acne. You have beta hydroxy, or excuse me, you have alpha, AHA and BHAs, beta hydroxy acids, and yeah. Oh my gosh, you guys are really testing my knowledge on dermatology. Alpha and beta. The betas, an example would be salicylic acid. The alphas would be something like glycolic acid or malic acid, or gosh, again, you guys are testing me on my dermatology. This is stuff that I haven't reviewed for a long time, okay? So I apologize, but it might give you maybe some information that you can go look up on your own. There are many products that have all of these things in them, but if I was getting a simple salicylic acid, I might lean toward Paula's Choice. I think it's a great brand of salicylic BHA, all right? If you're looking purely at a niacinamide, it is in a lot of the creams that are on the market. You don't necessarily have to get pure niacinamide, and you can get CeraVe, you can get, I mean, that's a great brand. La Roche-Posay has a niacinamide cream that I believe it's a matte, so it doesn't look like greasiness, and it's got great absorption. So La Roche-Posay, CeraVe, those are great brands. Paula's Choice is a great brand. Retinols are very, very expensive. The esters might be a lesser expense, but the minute you start getting into the retinaldehydes, they're very expensive online, and doctors won't prescribe tretinoin very readily. They just don't. I don't know why, but they don't. Do you have to get any special tests? I mean, you could get a vitamin A level. Of course, you do not want vitamin A toxicity, but I've never seen it. I don't have very many patients who are on retinols that I would have gotten a vitamin A, but it's worth looking into to make sure that you're not getting an overdose of vitamin A. So you're eating a whole bunch of sardines, you're eating liver, and then you're putting retinol on your skin. There are doctors I have listened to that say it is next to impossible not impossible, it's not very likely that a retinol which is vitamin A, will go systemic into your skin. And if you're a vegan, you probably don't have to worry about it because the conversion of beta carotene is not high. Okay? Shane says, gut issues is what I meant. I'm sorry. Try to put the whole question in here because it's hard for me to go back to know what you're talking about. Okay. Yeah, I agree, JG. We overconsume sugar, and it's a problem. Have you heard of Brian Johnson's longevity protocol? I have not, so I cannot speak to that. Okay. Yes, candida is very prevalent in high sugar states. Candida loves sugar. I remember, again, when I was a young doctor, I didn't know much about insulin resistance. They did not teach us about insulin resistance. They didn't really teach us much about diabetes, except for the fact that here's the medications that treat diabetes. And I remember seeing obese people in the hospital, because we had to do hospital rounds. I remember that these people would have tremendous candidal infections underneath their breasts. Even men who were obese with the gynecomastia, they would get candida growing underneath their breasts and in the skin fold. So if they had a large pannus of skin, it would fold over onto other skin. So when skin gets folded over on itself and then it's warm It's like a great bread maker, okay? And so candida grows in that area where you have skin on skin and it's warm areas and it's eating the sugar. So diabetics get it. It's very common. That's why diabetics get seborrhea. Diabetics get skin irritations. Diabetes is a strong signal for growth of candida. All right. And so we would just simply treat these people and try to fix their diabetes. We would treat them with, nystatin or something like that, or Nizoral shampoo or whatnot, and cause more problems. But they never really got to the root cause. They continued to eat their crappy foods, and we just kept advancing their medications. And eventually they were on insulin, which made their obesity even worse, which worsened their candida and the growth of the candida in their skin folds, in their groin, everywhere. It was everywhere, and you can smell it. You can smell candida from a mile away, and you can treat it with diflucan orally or ketoconazole, and it'll come right back because of their diet. Okay. Just chilling. I did give a recommendation for the dandruff, and if you do have hair falling out, there's something deeper going on, and you need to get some extensive labs. But for the dandruff, you can try some selenium sulfide. Barrel Space asks, how do you look at your hormone levels? You would need to you just get your levels checked. I mean, a lot of times your doctor won't check them, but you can get them checked. If you are in the United States and you're having troubles having your doctor order your labs for you, I can order them for you, okay? But your insurance will not pay for them. But if if you've saved up some money, you maybe got an HSA, you can use that credit card, I can order them for you. Linda is really busy, and I appreciate you being here, Linda. I'm sorry that you're having to eliminate so many bad comments. Oh, I didn't know that, AJ. Salicylic acid is good for clean makeup brushes or cleaning makeup brushes. I did not know that. Oh my gosh, Paula's Choice salicylic acid makes your skin feel baby soft. Just so you know. All right, Uncle Charlie is back. 177 pounds, just cold plunged at 38 degrees for 3 minutes. It sounds cold, Uncle Charlie. Sometimes I think I could just go stand outside right now. I'm in Iowa, and it is burr cold here. That is my terms. Just like bamboozled by the buffoonery and crapola diets, it is burr cold here. It is below zero with the wind chill, and it is cold. I do not like it. I do not like it. But one of my listeners, I don't know if he's still listening, sent me, I have it here because I took it off because I was wearing it, sent me a Dodgers hat. So I appreciate Eddie for being here. And I actually texted him and said, thank you so much for the warm hat. It's my second warmest hat. That comes second to my Iowa State hat, which has this fleece lining, and it's really super duper tight over my ears, and it keeps me warm. So thank you again for the kind gift of sending the Dodgers, and two, this warm hat to keep me warm in the below zero. I think it was 10, no, it was 11, it was yesterday, it was 10 below zero, and this morning it was 11 below zero with wind chill. So the regular temperature was 6. But yeah, I have hats scattered all over, just like I have glasses scattered all over. So I do love my hats. Stocking caps. Shane says, it makes sense, Doc. Thank you very much for all the info. Listening to your advice is a pleasure. Thanks again. Oh, you're very welcome. And click the thumbs up, you guys. If you're here, hit the thumbs up, hit the subscribe. This helps me. The super chats, the super gifts, the super stickers, all of that stuff helps. I do appreciate you guys. Especially DMSO. Braylon, I don't know what your question was regard to. You guys might be talking to each other. So 1910 says, I'm impressed on your derm knowledge, lady. Well, now just hold tight. Definitely do not claim to be any type of dermatologist, but I do take an interest in some dermatology stuff. If you're looking for a simple AHA versus a BHA, okay, simply go with glycolic acid. Pure glycolic acid seems to do better as an AHA. There's weaker ones. So, there's AHAs that get stronger and stronger, and glycolic acid seems to be okay. I believe it starts with an M. I thought it was malic acid. That might be a weaker one, okay? But it sounds like Waylon uses salicylic acid on his horse's feet. So you're using it as an exfoliant in what you're doing. It helps to exfoliate. And I've seen doctors use salicylic acid on the heels of people, or when they're trying to trim down calluses, they'll also use uric acid or urea. They'll use urea to on skin they'll put, you can buy lotions that have urea in them. They're very expensive as well, and they are a great daily exfoliant. They're not very strong urea. Don't stay. They're not going to cause your skin to peel off, but they are great even to use for people who have keratosis pilaris. Again, another reason to look into gut, which looks into all of your concerns of your diet, because anybody who's got gut issues likely has inflamed gut, and they're getting gap junctions. So in between all of their cells in their lining of their colon, they're getting gap junctions. Your cells should line up butt to butt, okay? And they should be tight junctions. When we have inflammation, we get gap junctions in between. And then things from the inside of our colon can get outside. And then we get reactions. We get joint aches and pains. We get skin reactions. And then we go to the dermatologist. They put us on something, to get rid of it, like some steroid cream or whatever it might be. And they never once looked into, not that, it's probably not even their job, but it should be their job, because obviously it was missed by the family practice physician. Again, these are whole, domino effects, but we're not looking at skin deep. We're not looking at the root cause, you guys, and that's important. So before we start going and going to all these specialists and just putting on med, find out what is going on with your inners. Something on the inside is coming on the outside, okay? I use CeraVe Hydrating Foaming Oil Cleanser. I do too. I like that one. Is that the one with the green writing? Is it the green or is it the blue? I can't remember. Blue might have salicylic acid in it. But foaming are going to be more drying. So if someone wants to use something that is less drying, and remember, okay, here's a great point. I don't mean to get into dermatology, but since we're here, let's go with it. If you're using something like a hydrating foam, okay, and you're using it because your skin is oily for a reason. So the more you dry out your oiling of your skin, you're actually going to cause your skin to produce more oil. It's a chain reaction. So we have to be very gentle with our skin. And the one that I'm thinking of is a gel. Hold, please. I can't tell. I can't remember. It is a gel skin cleanser. It is awesome. You can use it all year round, and it's very hydrating, and it will help even with oily skin. So we have to be very careful that we don't dry our skin out, take the oils too much away, because your skin is going to react and cause more oil. And then you're going to use more foaming cleansing, and then it's just a vicious cycle. Hopefully that makes sense. Braylon says DMSO allows some products to go through the skin barrier into the bloodstream, so certain vitamins are worth using topically. Be very careful with vitamin C, ascorbic acid on the skin. It's very irritating, and you might want to use a less irritating form of vitamin C called tetrahexadecyl ascorbic acid. Tetrahexadecyl vitamin C. Tetrahexadecyl. THD. Tetrahexadecyl. It's a form of vitamin C that is less irritating, and actually I think the penetration might be even a little bit better. Okay? Ascorbic acid, when we put that on our skin, it's very irritating. We likely put a too high of a percent on it, like a 1 or a 2%, and we waste our money on brands like The Ordinary or something like that. And the minute you unscrew that bottle and take out the dropper and put it on your hand and put it on your face, the minute you open up that bottle, air and light hit that vitamin C and basically oxidize it. So you're paying $100 for a bottle of Ordinary. I don't know what it costs. When you could buy a pump that is not exposed to it's not exposed to light or the air, so it's going to be stable longer. Sometimes putting vitamin C in the refrigerator helps to stabilize it, but simply getting tetrahexadecyl vitamin C might be in your best interest. So get that in your products instead of plain ascorbic acid. Whew. And DMSO has been used, I think, in compounding pharmacies, Braylon, correct me if I'm wrong, and it does help to be a vehicle for penetration of whatever compound you're trying to get through the skin, okay? DMSO. Lindsay, how does insulin make what worse? I'm just trying to go, it's hard for me to go back, but help me out with a better question. Linda says, please be respectful and ask doctor your health questions. Thank you. Should we pin that message? Please, do we really have to pin that? But I did. I pinned Linda's message to please be respectful. Oh my goodness. It's like we're in grade school here. Pura, what are your thoughts about people going against how nature intended and changing their genders? Well, Pura, since you're asking that question, I'm speculating, I don't know you, but you must be either for or against how nature intended. So you're saying that nature intended a certain gender. Nature being God, okay? God made, in Genesis, he made male and female. That's what I think, but I'm not going to answer for somebody who does these things to their body, okay? I know what my belief is, and Purav might have another belief. Now, our beliefs, just because we believe something, does not make them true. But I believe the Bible is the truth, okay? I bend everything back to the gospel. Yes, Ohio, Nizoro works great for dandruff. It does cause drying. You need to go maybe on alternate days, maybe only need 2 or 3 days a week of using Nizoro, and it will suffice. But I would work on the diet if you have dandruff. But thank you for that comment. I appreciate it. What would you recommend for cracked, dry skin on the side of the hand, just under the pinky, okay? So right here. Where are you resting your hand? Is there something you're coming into contact that it's only dry and scaly or cracked right there? But there's something called skin food. It comes in a little green. It's very thick. You can actually put zinc oxide on it. That will help as well as a skin barrier. But you could be putting your hand against something that you are, maybe a metal or something that you are intolerant of, allergic to, right there. If that is the only place, I would suggest that you look into a chemical irritant or a heavy metal irritant that might be causing that skin. But it's called skin food. It comes in a green container, a little squeeze bottle. It's about this color green, okay? The tube that it comes in. It's awesome. You can put it around your lips at night to seal in moisture, not inside your mouth, around, perioral. Makes me want to put some stuff. Do you guys want to know what I'm putting on since we're talking dermatology? CeraVe. CeraVe, it's like a petroleum. It's a healing ointment. It's a skin protectant. I'm guessing it has niacinamide in it, but the print is so small that not even a magnifying glass can read it. So if you guys want to look into it, comes in a tube as well. You can buy these, containers, or you can buy a tube and then fill them up. It's a lot cheaper that way. Oh, thank you, Linda. I appreciate you being here and being my moderator. I found out that Lucy is, she is away doing some family things, and RM, I have not heard. RM had an emergency yesterday, had to go to the emergency room, so we do not know what is going on there. Those are our moderators, and I do appreciate my moderators a lot. I go to a naturopath for perimenopause stuff, tests and visits not covered, but progesterone and continuous hormone birth control have saved my life. That's awesome, Lindsay. I'm glad to hear that. Must be, yeah. But at least you figured it out, right? Braylon says, Burr, cold, big smiles, come to Alabama. I don't believe I've ever been to Alabama, but it is a state that I would love to see. And I would especially like to go to an Alabama football game and an Alabama softball game. That's what I would like to do in Alabama. Okay, do we have any questions over here? Oops, Yes, UBC, I am live on YouTube. Yes, I am. And yeah, UBC, hopefully I answered your question on the NAC. I apologize. Okay, let me make sure the Instagrammers. Do I have any other questions on Instagram? Lion asks about red light therapy. Oof, I go back and forth on this. Red light is LED. LEDs, as you know, you're getting with EMF. Can infrared and near infrared light penetrate through the skin and improve collagen and elastin? Studies have shown they can. You could get into a spa, and I know we have them around here, a red light therapy spa, and go there 2-3 days a week. You get a membership and you sit in a red light therapy booth. Now, I have seen where there controversy comes with our eyes, that you should cover up the eyes and not let the red light, red and near infrared red, depending on the wavelength. I've heard Stephen Hussey talk about red light therapy at very, very high wavelengths when healing the heart, because it helps with nitric oxide production. Anytime you vasodilate, that's the endothelium releasing nitric oxide, which helps to vasodilate. So high wavelengths have been shown for cardiovascular health instead of taking medications like ACE inhibitors, which help with nitric oxide production, simply sitting in red light. You're going to find controversy both ways. People are going to say, no way, and like naturopaths and all of that, and you're going to find these others that are saying, okay, we got some benefits to red light. We can improve your skin, collagen, and elastin texture, so the youngness of your skin, and we can, at very, very high wavelengths, we can help penetrate the heart, and we don't need to take blood thinners or whatever it might be following a heart attack. Okay, so there have been studies. Stephen Hussey, I believe, is a chiropractor. I don't know much about him. He's even got a book out there, okay, that talks about, and he mentioned in that book about red light therapy. But getting a mask, I've seen a lot of skin changes with people who wear and use a infrared and near infrared red light, and they put it on their joints. In fact, I've used it on my boy Timber. I've used a halo. It's a halo. It's a red light therapy. It's, I believe it's red and near infrared for joints. And I used it along his back. I don't know if it helped. I don't know. Good questions on the red light. I wish I knew more. I guess I go back and forth. I go back and forth on that as well. I do think I've seen changes in people's skin with using the red light therapy, okay, on their skin with the red light masks. Ohio says, why aren't you teaching at a medical school? Med students definitely could use this information. They would never hire me to teach them something that is not on the curriculum of a indoctrinated medical school. How about that for an answer? Once they heard me talk, they would say, I'm going to pay you in advance to get you out of here. Don't come back. We don't want you here. Let's see. Autoimmune disorders, neurodegenerative disorders, addiction, depression, all tied to gut health. I agree. I can, is it that the only thing, gut health? Maybe not. I mean, but we have some things that go together with gut health, but it all compounds. And I would agree, all of those disorders that you just mentioned, yes, definitely. Okay. Lindsay says, morning, I only wash my face with water. Excellent idea. And my hands, well, with my hands. And then evening, I use a foaming gentle wash. I think that's a great idea. You do not, I think people overuse soaps. You do not, once you've washed your face at night and you're only exposed to your own bedroom and you change your pillowcase on a frequent basis, I don't believe that in the morning that you need to use another soap wash. It's only causing more destruction of your barrier of your skin. We need to protect the barrier and not irritate it or slough it off too much. So great point, Lindsay. I think you're onto something. Cool water or lukewarm water in the morning and a gentle wash in the evening. And then after washing, then you put on your evening routine in the morning after you just splash on the water and wash and, use your hands. You can put your morning routine on. So most people who are into their skin will put a morning routine and an evening routine. A multivitamin, Bathai, I'm sorry if I mess your name up. Is a multivitamin a recommendation? I do not recommend multivitamins. If you need a multivitamin, it tells me that your diet is bad and it's crapola. You have a crapola diet and you need to fix it. You should not need a multivitamin. Multivitamins have synthetic vitamins in them, and the one that I'm fully against is synthetic non-heme iron that is in multivitamins. Okay? Non-heme iron, we're getting so much of it in all the processed foods we eat and plants. The minute you eat a plant, that is all non-heme iron. We cannot absorb non-heme iron like we can heme iron. Heme iron is about 30% absorbable, non-heme iron about 3% absorbable. If we don't have a way to chelate it, bind it, sequester it, it literally can get trapped in our organs and our tissues. And we get non-heme iron overload, okay? It does us no good, except for it causes a lot of oxidation and rusting inside of our body. Dean asks, what do I think of GLP injections? I would say that your body makes GLP, and why do you need an injection? That would be my first thought. So if you can answer that, then I can go from there. Mary Pratt, I don't know why you guys are talking about Tylenol and ibuprofen, but I must have missed the question. Something about injections for migraines. I would ask, why do you have a migraine? Could it be iron buildup? Could it be your diet? Could it be your crapola diet? Hyperinsulinemia, insulin resistance is a leading cause of migraines. Okay. D. Fields asks, can eating ground beef, eggs, and beef tallow help with my fatty liver? Yes, as long as you don't eat anything that has carbohydrates. Carbohydrates is what leads to hyperglycemia. Hyperglycemia leads to hyperinsulinemia, and it's hyperinsulinemia that leads to fatty liver, along with alcohol. But fructose and alcohol are the biggest causes of fatty liver. Now, with that being said, if you are a carnivore, so you carnivores out there, please hear me please hear me out. If you find that you're carnivore, and I mean truly, truly carnivore, you're not eating cheese, you're not eating all these other things, okay? And your fatty liver is not going away, I would suggest that you back off on your fat. Back off on your tallow, back off on your butter, back off on your fats. And let your body start using the fatty acids that are on your body, in your body, as an energy source. I'm not saying that the saturated fat caused your fatty liver. I believe that the saturated fat cannot cause your fatty liver unless it's in the presence of carbohydrates. That's when it becomes a problem. But if you are truly carnivore and you're having trouble getting rid of your fatty liver, I would start sprinting and I would decrease for a short period of time the amount of fat in your diet. Now, with that being said, you could be hungry and that could be a problem, and then that could tempt you to eat other things because fat is satiating, keeps your appetite low. You might need to eat more protein, okay? I'm not saying give up fat completely. I'm saying don't add it. Don't eat tablespoons of tallow or ghee or butter. Just put a nix on that and just cook the meat that you buy as is. You don't need to pour all of if you get 70-30 ground beef, I do not suggest that you continue to pour all of the grease or drink all of the grease in order to get your fat. So maybe put a nix on that for a while and see if you can't calm down that fatty liver. Ooh, Adam, good question. I don't know if I could answer this question. Well, we're on the topic of light therapy, red light therapy. Is wearing copper any good for the heart? Oof, this is a great question. What I worry about with any heavy metal is toxicity. Without getting an RBC copper level, I don't know if I would wear a copper bracelet or, drink out of copper cups or do any of that. I will tell you that people who are low in copper, okay, who are low in copper, which means they're low in vitamin A, will have more iron trapping and non-heme iron trapping in the heart, in the liver. When we have non-heme iron trapped in our organs, it oxidizes. And if it's in our heart, you're going to get heart disease. If it's in our liver, we get liver disease. We're getting rusting in our body from iron overload, despite the fact that your doctor will say, no, your iron's fine. No, it is not. They're just not looking deep enough, okay? So it is important to get, when we're talking about copper, and the minute you start putting on a copper bracelet or something like that, I suggest getting an RBC copper level, a vitamin A level, and iron studies. So a serum iron, a TIBC, a transferrin, a ferritin. I would even get liver function, AST, ALT, and GGT, and I would get a CBC. So you can see this is very complicated. Instead of just answering your question, hey, should we just put a copper bracelet on to help my heart? Well, the minute we start doing stuff, we could be getting too much copper, too much this, too much that. And now you got heavy metal poisoning. Now, if you have too much copper, what is that doing to your body, right? What's it doing to your vitamin A? What's it doing to your ceruloplasmin? It's so complicated, but we need to check before doing anything. How about that? And where we have a problem is your doctor doesn't know any of these things, and so will not check them. So you're going to have to go out and be your own advocate and get your own labs. And like I said, if you're having trouble getting your labs ordered and you need somebody like a doctor to order them, I can order them. Just email me at IronLadyDoc@AOL.com. I will not charge you to order your labs for you, okay? I don't do that. So if you want your labs checked and even if you want a list of labs to ask your doctor for, just let me know. On my current list, I do not have a vitamin A level and I do not have a copper level. I don't have RBC copper, RBC zinc, because they're very expensive. And so if people want those, you got to let me know. If you want your vitamins and minerals checked, like a zinc level, you got to get an RBC zinc. Selenium, RBC selenium. Copper, RBC copper. A vitamin A, vitamin D, liver function. All of these things need to be taken into consideration, looking at the whole big picture. Hi, Ron. Thanks for being here. Butch says, fat is something that humans crave. I would 100% agree with you. Kevin says, my iron is fine. My doctor said so. Kevin, I would look into it yourself instead of just simply trusting your doctor. Karina says, can prediabetes go from 5.9 A1C to 6.4 in 3 months? Yeah, it could go that direction in 1 month. Yeah. Looks like Linda is very active trying to get people to be nice on this channel. It's amazing to me that we're even having to say this, but I guess it is what it is, and we should all thank Linda for cleaning up things here. I really do appreciate her today. I don't know what she is eliminating because I can't see it, but I can see when messages are deleted. Oh, here was one that was actually eliminated from Nightmare. You earn money from live, and how much do you earn? I actually don't know, and the only way I earn from live is from super chats and super stickers. So you guys can actually see when somebody gives me a super chat or a super sticker, you'll see how much I am getting. So if you want to know how much I'm making, Nightmare, right now I'm making 0 on my live. This is all free. So thank you for asking. And Linda, if there's something like that, maybe let it go through. I can, maybe ask something like that, answer something like that. If I choose not to, yeah. Some of the things that, Linda, we might need to maybe let go just a bit, maybe be a little more lenient and see, where it's going. If it's truly derogatory, then let's, 50 says, 55, 5511, 511, 511, 511. That's a brand. I always get my health advice from a lady on YouTube Live. Oh, okay. Thank you, Hans. I appreciate it. Oh, Ohio's asking, is grass-fed beef organs capsules okay to supplement rather than eating the meat? Well, no, you should eat the meat. I think what you're asking, Ohio, is is it okay to take these grass-fed beef organ capsules instead of eating the organs of the animal? I suggest eating. You guys, you should eat whole foods. You should actually eat the organs. But if you're not going to, and as Dr. Barry says, if you're going to be a baby, a child, then yes, eat the capsules. Okay? Okay. So Linda, be a little less on, maybe we can go over some of these. Let's see. Mary, I don't know what your question is that you're asking. Put a question mark in front of it so I can see what's going on. Butch says, eat fatty food and feel full. So eat fatty, yeah, but the minute we start putting it with carbohydrates, Butch, is where we get a problem. So eating fatty food does make us feel full. It's satiating. If you are eating veggies and other carbohydrates, you will be hungry all day because there's no fat in them. So yeah, I can agree with that. You wear a mood ring. Do those really work? I don't know. I don't know if they do or not. Heart failure, ask, are you vegan? No, I am not. Hello, Tipping. Thank you for being here. Oh, 1910 says, you had mentioned you switched your philosophy about 4 years ago, mainly about how being a doctor, okay? But yes, as far as carnivore is concerned as well. How long have you been eating mostly carnivore? That I've been mostly that carnivore for 4 years. Now, there was a 15-year stretch where I was bodybuilding. And when I was bodybuilding, I ate a very low, no carb diet and mainly protein, but no fat. And so that was like a roller coaster for 10 or 15 years, or 10 to 15, about 15 years. I would do 2 shows a day. That puts you at a good 8 months of dieting, or excuse me, 2 shows a year. That would put you at, so I would diet for 4 months, and that would put you at 8 months of the year. I was very low carb. So I was very lean most of the time. The past 4 years is when I really started, I was already low carb, but what I really started to do was increase fat back into my diet. And it has been an amazing change in how I feel and even my skin. And I've had people, I don't tell people what I do, okay? But I've had people say, oh my gosh, your skin looks like 100 times better than what you look like you're reversing aging. Now, no, I'm not reverse aging. I am aging. But the thing that changed in my life over the past 4 years that have improved my skin was adding fat back. So 1910 and Butch, I think fat is the key. And you have to know what your body is good with. I went up to a 2-to-1 ratio. So if I would eat 125 grams, 130 grams of protein, I was getting about 260, 250 grams of fat. And I started backing that down a little bit. I'm now at about a 1-to-1 or a little over a 1-to-1 ratio. I'm probably at 130 grams of protein, 150 grams of protein, 150, 160 grams of fat, almost about a 1-to-1. And that is where I found like my sweet spot, where I feel the best. Yeah, please, Honda, drop a thumbs up for me. I really appreciate it. For those listening, hit the thumbs up, hit the like button. I think it's the like button. And subscribe if you haven't already subscribed. Do so on Instagram as well. Any suggestions after umbilical hernia repair, healing, strengthening? Let it heal. I don't know how old you are, Lara, but let it heal. Do not work any abdominal exercises. Don't be, increasing intra-abdominal pressure too much. If there's one thing that you're going to piss your surgeon off is if you blow that mesh from the hernias. I remember hearing a surgeon talk about that, where his people went back to exercising, lifting weights, holding their breath, causing intra-abdominal pressure. And that goes along with constipation as well. When you're sitting on the stool and you push hard to try to relieve yourself, you're increasing intra-abdominal pressure and you're hurting that hernia repair. So be nice to yourself. Don't put a band around it. I'm not saying that, but be nice to yourself and, let it heal. It's going to take 8 to 10 weeks. And then get back into your exercise program gently. You can definitely walk, okay, and do some cardio. And you can do some light exercise. So please do so. Do I like Dr. Pepper? I do not drink any soda. So thank you for asking. Yes, 1910, Linda is cleaning up the riffraff. She is. Oh, Sarah says, how do I try to like meat? I want to eat meat more because it's protein, but I find it hard to enjoy. I would start really with fish. Start with fish. Then start with just, and it's tiny little doses. You know, getting started might just be one bite. That's it. One bite every meal. Okay? There's no rush to it. If you're grossed out by it, I mean, people are grossed out by Brussels sprouts, and they might eat a tiny little piece of Brussels sprout. Again, I've refrained from, I'm just giving you an example, but at first they're so bitter for a reason. They're not supposed to be eaten, but you'll just eat a tiny little bit, and eventually over a few years' time, you're eating a whole plate full of Brussels sprouts with salt and vinegar and with no nutritional value. FHL says, is vitamin K good to take? It's especially good to take if you're on a cholesterol-lowering medication like a statin, atorvastatin, Crestor, pravastatin. So vitamin K needs to be made. We need vitamin K2 and K1, but K2 for our bone strength and our teeth strength. And if you're not getting this in your diet, you might need to take vitamin K. Okay, vitamin K2, the MK7 and MK4. There's two different versions. Vacaro. My mom is telling me all meat is horrible for you. What should I tell her? Nothing. Just do your thing and let her do her thing. You aren't going to change people, okay? And they only change if they want to be changed. You cannot will it on them. Just don't say anything. They're trying to get you to react. Don't react. Have boundaries. Have boundaries and don't react. If they don't want to eat meat, don't say anything. Don't pressure them. It's not necessary. Okay? It's not. I know you're trying to help and that is commendable, but it's not like your mom is on this live stream right now wanting to get more educated. You are, she is not. She's likely in the blinder stage where she's only got tunnel vision from what she's been fed by the media, by the doctors, by the indoctrination. She's been indoctrinated where you are showing signs of some cognitive dissonance, okay? So you are listening to me say that animal meats are fine for you, okay? They're not gonna cause a heart attack. And then, but your belief over here where you were being fed this information. So cognitive dissonance is two competing themes. So the fact that you're worried about her and her theme is you're going, oh my gosh, well, maybe she's right. No, I'm right. Just stick with what you got going on and let her stick with what she's going on. She's an adult, and if she wants to change, she's going to change. And if she doesn't, she's going to die not changing. And you're going to die not changing yours. Okay? Girl on a mission. Hello. Thank you for being here. Yeah, Rod, I'm sorry to hear about, sounds like you have a problem with, obesity or overweight, but adding more fat to your diet isn't going to make you more fat. What you need to do is to get into some form of ketosis in order to burn your own fat. So if you are fat and you don't want any more fat and you want to burn your fat, the only way you can burn fat is to get your insulin level in the optimal range of 3 to 5. Insulin, not glucose, not A1C, fasting insulin level. If your fasting insulin level is ideal, optimal at a range of 3 to 5, you will start using your fat on your body to make ketones. And that ketones is your energy source. Instead of carbohydrates, they have the exact same calories source. Both a ketone and a carbohydrate have 4 calories. However, a ketone can be excreted in your urine and in your breath. So you are getting rid of calories just by sitting. If you eat carbs, thank you, Bonnie. I appreciate that gift. I do appreciate you guys thinking of me and thinking about this channel and making it want to move forward, upwards and up and away. I appreciate it. Thank you, Bonnie. I appreciate that. Okay. So yeah, getting that insulin level down will get you in a state of ketosis. You can even fast. If you're overweight, nothing is going to happen to you. You will have energy. It's on your body. You likely got months on your body. I know I have months on my body. I could not eat and I would be fine. Okay. Maybe a month. I don't know. I mean, there is evidence of people living 365 days without eating. Yes, they were getting some electrolytes, but they did not eat anything, and they used their suitcase full of energy that they're carrying around on their body. And that I'm not gonna entertain these questions. There's some questions I'm not going to entertain. Okay. Let me see. All right. And J3 says tinned fish on toast or not toast, right? Where's the nutritional value in the toast? Wayne asked, does copper really stop your hair from going gray? Because I take in a lot of copper, but I'm still getting more gray hair. Wayne, do you eat a sugar diet, a diet high in carbohydrates? I believe, this is me, but I believe that changing of your hair is due to glycation and oxidation. So people who have so that's epigenetics. So maybe genetically you could say, yeah, my parents had white hair at a very young age. I believe that genetics can be changed by what we put in our body. So if you're around a lot of exposure to chemicals and you're eating a diet high in carbohydrates, you're getting a lot of glycation, you're getting a lot of oxidation, you're going to have problems with graying of your hair. And yes, I have seen this too. Brian on Instagram says that his gray hair is reversing. His hair is getting darker after going carnivore. And I've seen this as well in some of my long-standing patients. And I know that they're not, because I can still see strands of gray, but it's less in their hair. They're actually, it's not reverse aging, but they're slowing down the amount of oxidation and glycation that's going on in their body. It's oxidation. Your antioxidants cannot keep up with all the oxidations that's going on. And I mentioned iron oxidizing. I mentioned glycation. But what about everything that's in the air that you're breathing? What about the water that you're drinking? All of these things add in. But if you could simply change your diet, that's an easy one. If you could change your water to filtered water, that's an easy one. Okay? There's just some things that you can change and help. But I think on a carnivore diet, and I've seen it, that hair has repaired itself and the pigment has come back. Okay, Mohammed says spaghetti is proven good for heart disease. Mohammed, keep eating spaghetti then. Sounds like you're onto something. Yeah, sounds like you're onto something there, Mohammed. Research on your authentic spaghetti and see how that goes for you and let us know, okay? Oh, yeah, Brian also brings up the fact that getting rid of chemical shampoos is in your best interest. I would agree. You can get natural shampoos that use apple cider vinegar and natural oils. I think like jojoba oil, things like that will be a great. There's one I use. I can't think of the brand, but it's on Amazon and it's all natural. There's nothing in it. Maybe it's got black seed oil in it. Oh my gosh. Yeah, I can't remember. Pi says, let's talk about A1C. What would you like to know? Chris says, I researched as you suggested last week, will any food increase protease inhibitors and lymphocytes in the body? Will increase protease inhibitors. That is something I would have to look up. If you have to increase protease, so proteases, lipases, our amylases are made in our pancreas, okay? They're made in our pancreas, in the exocrine portion of our pancreas. So if you are wanting to take an inhibitor, I don't know why. Why do you want to inhibit your protease, which a protease is needed to break down protein into its building blocks of amino acids? So tell me your theory, Chris, by increasing protease inhibitors, okay? I don't know. Bonnie says, thank you for your information and your kindness. We can't change other people's opinions, and there's no sense aggravating people. I'm new to these stickers, but love the disco ball dancing. I liked it too. Thank you very much. Okay. Angel, I'm not understanding. If you have a question, please let me know. Because my pancreas is slow. Okay, wait. They got two things going on here. Spiegel says, I'm worried, but still all of my labs are okay. What are we talking about? Okay, my insulin has dropped over time. It used to be 11 to 8, and my last fasting insulin was only 2. Okay. I asked ChatGPT if I should be worried. The weird thing is my insulin dropped after eating carbs. I'm worried still, but all my labs are okay. This is after going high carb for months. I need to go back to low carb, but I don't know why my insulin is so low now. ChatGPT said my A1C goes pre-diabetic because my pancreas is slow. Okay. Whew. There's a lot here. A person who goes low carb or no carb, their pancreas does not have what we call pre-insulin. If you are a person that eats carbs on a regular basis, your pancreas almost prepares for the fact that you're going to eat them. It knows that you're going to eat these carbohydrates. If you are low carb, okay, you're a low carb, no carb person, your pancreas is going to be a little slower on secreting insulin if you do eat the carbs. Okay, let me rephrase. A carnivore person who eats no carbs will have no pre-insulin on board, and they will secrete at the time insulin, or they'll form insulin per the meal. A person who eats carbs on a regular basis, okay, will have a pre-insulin already formed. It's almost like thinking about the carb and you'll release insulin. They have it already. Jordan, thank you so much. I saw that. I appreciate your gift. I appreciate it. Thank you. But in a person who eats carbs on a regular basis will have pre-insulin, okay? Now, if all of a sudden a carnivore person starts eating carbs, their body doesn't have that pre-insulin. Their blood sugars will go up, and now they will secrete a bunch of insulin to take care of that blood sugar, okay? Even though they're insulin sensitive. It's a dynamic that you need to watch. It's nothing abnormal. Again, please consider a consultation, to go over this specifically, but I'm guessing that is what's going on. And just looking at it, again, it was all over the place. I know listening to ChatGPT tells you that you're pre-diabetic, but there are carnivores who look pre-diabetic, especially in the morning, and they're not. They are not pre-diabetic. They have a kind of a false elevation of their blood sugars, okay? It's only because they do not have preformed insulin, because their body knows they don't have to have a bunch of insulin pre-made for your crapola diet. How about that? Okay. Good. Okay, great question. Wayne is carnivore, lost over 200 pounds. Gray hair, just go with it with being old. Well, you might be surprised. It might come back, but Wayne, congratulations. Who doesn't want to lose 200 pounds of excess weight that they have on their body? So everybody give a congratulations to Wayne. That is incredible. Incredible. John Doe says, spaghetti, good, I'm in luck. No. Spaghetti is pasta. Pasta are carbs, and carbs are sugar, and sugar raises insulin, and insulin is needed, but just not in the amount that we have insulin in our body. The optimal range of insulin is 3 to 5. A carb potato junkie here, plus tons of iron, same oxidation you spoke of. Yes, the shampoos is a huge thing. I like honey products, makes a huge difference. Well, thank you, Angel, for letting us know. Pines makes a nice shampoo. We'll keep that in mind. No, Spiegel, your insulin is not too low. If you're carnivore, it's not too low. If it was less than 1, then we need to start checking some things. You need to check for, remember, people who have low insulin, I know this is going to sound crazy again, but insulin is 2 strands of protein. If you are malnourished or not getting enough protein, guess what? You can't make insulin. Insulin needs amino acids. If you are not, Wayne, I just want to tell you, Carla congratulated you on your weight loss. Okay. Yeah, Spiegel, I would definitely check into antibodies for type 1 diabetes. You might be a type 1.5, and you are, your pancreas is under the weather. So get a GAD antibody. There's there's 5 of them. There's 5 enzymes, 5 antibodies that you need to be checking to make sure that you don't have a late onset type 1 diabetes or something like that, okay? It's a possibility. But I don't know all of your labs. I would love to schedule a consult with you if you would like. Okay. Pie, low iron levels. Okay, I don't know what the questions are. I can't keep up. If you got a hemoglobin A1C of 6.4, that's diabetes. What is the best overall supplement? There are no best overall supplements. It's eating a whole food diet. So eat an animal-based diet, and if you choose, put a few plants alongside of it. You're welcome, Heath. I appreciate that. Okay. Pi says, my blood test, my B12 was low. I don't know what low is. Iron was low. I don't know what low is. D3 was low. I don't know what low is. And hemoglobin A1C was 6.4. You have diabetes. Okay? Marshmallow Man, I think you should see your primary care doctor for your concerns. Bonnie says she got her first gray hair at age 8. Started modeling in her teens and started dyeing her hair in her 20s with a bunch of chemicals, I'm assuming. Now in the 50s, stopped dyeing it. My cluster migraines have stopped. Imagine that, right, Bonnie? Wow. Thanks for sharing that with us. Okay. All right. Okay, you guys. I don't see any more questions that have popped up. I want to thank Linda for being my moderator, and maybe we need to be a little more gentle with people and let them ask questions if they need to. Yeah, Wayne inspires. I agree, Linda. So does Uncle Charlie. We appreciate these men being here and telling us their story, because you never know who's listening and it can help somebody. But people out there are doing it, and they're doing it on carnivore, and they're doing it on low carb keto. Things are changing. They're getting metabolically sound, and they're not afraid to do it. And believe it or not, they're not having heart attacks. From my perspective and from my experience, the people who had heart attacks were definitely not the carnivores, okay? You're very welcome, 1910, and I appreciate you being here, and I appreciate everything you guys have done. But we are here every Saturday at 9 a.m. Central and Sunday at 10 a.m. Central. So please like, subscribe, share to your favorite platform, share to somebody who might hear me for the first time and say, you know what, I like listening to her. Or say, you know what, I'm never going to listen to her. And that's fine too. You'll find somebody that you like listening to. And it may not be me. Or it might be me. And that would be swell. Perfect. Okay? So follow my reels. I try to do one every day of the week, and then I do my live streams on the weekends. If you have a topic that you would like to have me talk about, just DM me or email me at IronLadyDoc@AOL.com, IronLadyDoc@AOL.com. If you want me to give you a list of pertinent labs, email me and I'll send it to you. If you want to schedule a consultation, email me and we'll get that scheduled. Otherwise, you guys have a blessed Sunday, all right? See ya.